The advanced course for health information and policy making is extremely important, not just because we're bringing people together on a training event. What really happens here is we consolidate what the autumn school, our main flagship training event, did 8 months earlier. A group of experts who work on data and policy, they come together and they discuss how to use data best and evidence and information best for policy making. So they go on the whole journey from generating to looking at, analyzing, reporting, and then using data for policy. That is important. This is not something you can read in a book. And you also need the interaction with the people who come from the same country. And this is why we bring data people and policy people together in the same event. And then again, 8 months later in this advanced course, they come back together again. They have a group, they already have gelled, they're cohesive, but they also now know that they're taking it to the next stage. So when we work with people at the country level and they have done this course and the autumn school, we know exactly what they know, what to use and how to use. And so our interactions with countries, ministries, National Institutes of Public Health are very much strengthened. This is really the whole essence of the course. It's not just to convey information, but to use information and to use it for policy, so that policymakers also always get the same message about the information they use. Now, the European Health Information Initiative is chaperoning this entire event. It's chaperoning both capacity building events. And this is important because this has the support of now 39 members, mostly member states, but also other organizations like the OECD or the European Commission. And together we shape and harmonize health information in the European region. And when you look at the capacity building courses, this is what they fall into. This section here, capacity building, but they do more. They're also familiarized with the other aspects of the initiative, the networks that exist, the strategies that we use and that countries themselves also employ. But also really we give them access to the measurement types of things we do, we give them access to our tools, and they measure using our tools. So this initiative is really the umbrella for everything we do in this course, in the previous course, but also the work that we do with the countries. This is the overarching strategy, in a way, for the European region on health information, evidence and research. And this is why it is so important. It is important because it brings it together, it is coordinated, and it makes sure that people speak the same language when they talk about information. So this is not just a structure, this is actually a living beast. And it is growing, and more countries are taking part, and the global level is now taking real interest. Our member states have said repeatedly to a new Director General, this is something you should do also globally. So we're very happy to be able to support that, and we hope that one day we will have the Global Health Information Initiative.